Hi, I'm Dr. Jennifer Ronderos, and I practice aesthetic and anti-aging medicine. The name of my practice is the Aesthetic and Anti-Aging Medicine Center. We are located at 1132 Hillcrest Road, Mobile, Alabama. I've completed the fellowship, the first 5 modules, and I've done a couple additional, and passed my oral and written board, so I'm board certified now with the Academy for Anti-Aging Medicine, and it's completely changed my practice. You know, I've found that the aesthetic type of medicine, people wanting to look better, goes hand in hand with the functional type of medicine, people wanting to feel better, and we really accomplished both in my office. We do the traditional medicine, but we also add the more advanced hormone evaluation. We get an overall picture of their health, and we use natural hormones and nutraceuticals, and then traditional modalities as well, in combination with aesthetic procedures, and we really transform people's lives. People come in very commonly complaining of memory loss. They're having foggy thinking. They go into a room and they can't remember why they went there, and family members are starting to notice. And those symptoms go hand in hand with their other symptoms of hormonal deficiency, such as fatigue, insomnia, loss of interest in their usual activities. And when you do a hormonal evaluation and you can restore some of these hormonal imbalances, well, that basically slows the aging process. You can think of restoring hormonal balance as giving people a supplement. You're giving them back what they don't have enough of anymore. And hormonal decline is actually a normal part of the aging process. But with hormonal decline comes cognitive decline, and as well as chronic diseases such as cancer, cardiovascular disease, diabetes. All of those things are associated with declining hormones. So when you can restore hormonal balance, you find that patients do have better memories and cognitive function, and you certainly slow that decline, as well as improvements in their symptoms of fatigue and insomnia, correcting adrenal fatigue, something that occurs with, it can be an acute stressor or a lifetime of stress. We all have plenty of stress, we live busy lives, and you don't find too many people who don't have some kind of impairment in their adrenal function. Patients who desire weight loss or who have diseases associated with being overweight, such as metabolic syndrome, diabetes, even cardiovascular disease, do see improvement with bioidentical hormone replacement, nutraceuticals, and lifestyle changes. So the most common complaint I probably hear from patients coming in from the first time is that I'm gaining weight, particularly belly fat, and nothing I do is helping me to lose weight. I can't lose weight despite diet, despite exercise, and it's primarily belly fat. Some patients may have always been overweight, but they're putting on more and more weight. Some patients have never been overweight, and all of a sudden they have this belly fat, and they haven't changed their lifestyle, they haven't changed their exercise patterns. So we find a big improvement. We can give them hormonal balance and also, lifestyle interventions. They might not realize that the way that they're eating is contributing to the weight gain. And so we do a lot of nutritional counseling. And also when you're nutrient deficient, that causes difficulty with weight gain as well as other symptoms they may be having. So we actually do testing to determine nutrient status. And so it's a comprehensive approach to patient care that includes lifestyle, diet, nutraceuticals, hormones, and sometimes patients do need traditional medication. We treat hypertension, we treat thyroid disorders. So it's really a comprehensive approach to their health that really has a big impact. My goal with the aesthetic medicine is to correct things that are making the patient self-conscious. So those subtle signs of aging that maybe nobody else notices, but when they look in the mirror or when they see pictures of themselves, that is what they're focusing on. A very common thing would be nasolabial folds, these folds between your nose and your mouth that, that is one of the signs of aging that we can improve, and it's usually a very subtle thing. Nobody can quite pinpoint what you've done, but they know that you look refreshed. And so it's a great compliment to have someone tell you you look refreshed. And that goes with Botox as well. With repeated contraction of facial muscles, you develop lines on your face that are what we call static lines. They're lines that are there without expression. And there's also facial muscle training. So commonly, women in their early 40s will come to me and say, everybody thinks I'm angry because I always have this frown on my face and I can't make it go away. And that's basically facial muscle training. So Botox works very well at reversing that, relaxing those muscles, and over time, those creases that have formed will improve a lot. In some cases, they will completely resolve, and of course, Botox also stops the progression of that. Our practice also offers laser hair reduction, which is a 85% permanent reduction of hair in areas of unwanted hair. Works very, very well. It's a very quick procedure. We also have lasers to remove pigmented lesions such as sunspots, and we have a laser to treat vascular lesions such as telangiectasias on the face and leg veins. In addition, I perform sclerotherapy for those larger leg veins. If you'd like more information about our practice, you can go to aestheticantiagingcenter.com and you'll find more information and also our contact information.